I talk to people who are endocrinologists or diabetes researchers who are based in a hospital system, and everybody has a horror story.
So in this scenario, I saw the very high elevated level of vancomycin in this patient. And this particularly IV antibiotic can create kidney complications if it exists in a very high dose in the body. So basically, the idea was that that dose should have been withheld that day, and now the patient had an extremely high level of this drug in their body and was starting to get kidney complications as a result of it.
We used to admit people to the hospital all the time if they were going to get intensive chemotherapy. Now much more of that is done outside the hospital, and often the patient themselves is in charge of deciding exactly how much to take.
I think it was after a weekend as well where we didn't have clinical staff looking at that every day, and you have a reduced clinical staff on as well, particularly pharmacists in that scenario.
And the hospital setting is probably, again, depending on what the patient's in there for, is probably the most difficult setting to be in.
Classic example is when adult strength heparin is put in the neonatal intensive care unit, so where there are a lot of babies, and if you give a baby a dose of adult strength heparin, they predictably will die. There was one hospital in Ohio in which that happened, and 3 babies died before they figured out what was going on. Finally, when the 3rd baby died, they realized that there was concentrated heparin that was being given to these children. And an issue there is that the vials look very similar. So just looking at the vial, you wouldn't necessarily notice anything.
Even if somebody follows, let's say, the protocol to the letter, doesn't mean there's not going to be an issue.